Hi, my name is Brittany Moore. I am recording my abdominal assessment for MSN 572. Today is October 22nd, 2025. I am showing my computer screen and then an ear check and a room scan. So that is my kitchen island. There is my kitchen. And here is the floor over there, and then the floor here. And then there's the ceiling above. Okay. I may have to move this computer screen to make sure we're in the right place. Also, I have supplies. I have a, tape measure and a pen for marking, and then my stethoscope. Okay, so I'm going to begin cleaning my hands with hand sanitizer. Hi, how are you? Good. My name's Brittany Moore. I'm a nurse practitioner student with United States University. How are you today? Good. Well, can you first start by telling me your name and your date of birth?
January 24th, 2014.
Great. Okay, and how old are you?
11.
Awesome. All right. This patient is under 18, so he is not legally able to consent for himself for this video. So I am his mother, and I am consenting to have a video of this assessment recorded and upload to YouTube as unlisted so my professors can view it and grade it. So I will move on. Okay, well today I'm going to be doing an abdominal assessment on you, okay?
Okay.
Do you know what that is?
Yes.
Okay, well what I'm going to have you do is I'm going to have you lay down on your back, and you can have that pillow under your head, okay? Great. Are you comfortable?
Yes.
Okay. I'm going to put a pillow underneath your legs also. Go ahead and lift those high up. Good job. Wonderful. Does your abdomen feel nice and relaxed?
Yes.
Great. Okay. I'm also going to put this drape. This is just for some privacy, okay? And I am assessing the patient from the patient's right side. I have the patient in a supine position, and his arms are relaxed at his sides. Okay, so first things first, did you have a chance to empty your bladder before you came into the exam room today?
Yes.
Good. All right, and I am going to either lift your shirt up, or do you want to lift your shirt up?
I want you to.
Okay, so I'm going to lift your shirt up. I'm going to lift it up to about the level of your nipples, okay? And that's so I can have a good view of your stomach so I can do a good assessment, okay?
Okay.
All right, so first things first, I'm going to start with the inspection. So that means I'm going to look. So I'm going to inspect the abdomen. As I'm inspecting this patient's abdomen, I'm first noticing the contour. The contour is flat, it's symmetrical. There is no visible peristalsis. There is no pulsation of the abdominal aorta. There are no bulges. There are no masses. There are no rashes, no lesions, no hernias. The umbilicus is midline. I'm just going to pull your pants down just a little bit so I can see your belly button a little better, okay? Okay, just like that. Let me put that right there. The umbilicus is midline, and I do not see any evidence of inflammation, and there is no hernias associated with that. His skin temperature is warm, his skin is dry, and then upon looking at the skin color, it's normal for, or is appropriate for ethnicity, and there is no jaundice. I'm also looking at the sclera, which is free of icterus. There are no rashes, no lesions, no striae, no scars, and no dilated vessels here on this abdomen, which is all normal findings. The next thing I'm going to do is I'm going to listen. So I'm going to use my stethoscope and I'm going to start listening. I'm going to listen throughout the bowel sounds, so the 4 quadrants of the bowel or the abdomen, listening for bowel sounds. I'm listening for the frequency and the pitch, and I'm listening for normal active bowel sounds, which would be 5 to 34 bowel sounds that sound kind of like clicks or gurgles per minute. So in this right lower quadrant, that's normal active. And the right upper quadrant is normal active. And as I'm listening in the right upper quadrant, I am not hearing any hepatic friction rub. Moving over to the left upper quadrant, I'm hearing normal active bowel sounds and no splenic friction rub. And then into the left lower quadrant, and I'm going to pull your pants down just a little bit again so I can hear better. I'm hearing normal active bowel sounds. So normal active bowel sounds, which is a normal finding in the 4 quadrants of the abdomen. Next, I'm going to listen to the some of the abdominal vasculature, starting with the abdominal aorta, and I'm listening for a bruit. I'm going to start listening with the diaphragm in this epigastric region, listening for a bruit in the abdominal aorta, and then listening with the bell. And I do not appreciate any bruit. Moving inferiorly down to the left renal artery, listening with the diaphragm and the bell, and I do not hear any bruits. The right renal artery with the diaphragm and the bell, and I do not hear any bruits. Moving inferiorly again, down to the left iliac artery, and I do not hear any bruits, listening with the diaphragm and then the bell, and I do not hear any bruits. The right iliac artery, listening with the diaphragm and the bell, and I do not hear any bruits. I'm going to listen to both femoral arteries. However, I'm going to listen over the clothing. In clinic, I would listen directly on the skin, but for privacy for the patient in this video, I'll just listen over the clothing. So the left femoral artery with the diaphragm and the bell, and no bruit, and then the right femoral artery with the diaphragm and the bell, and I do not hear any bruit. Okay, the next thing I'm going to do is I'm going to percuss. So I am going to percuss in the 4 quadrants of the abdomen. It's going to be a little difficult to percuss this lower both lower quadrants of the abdomen because of where his pants are at. I'm going to pull them down just a little bit, okay? Just to get in here. And then what I'm listening for, okay, go ahead and relax, is I'm listening for the difference between tympany and dullness. So tympany is the prevailing sound within the abdominal cavity. But if I'm hearing dullness, it may be a sign of a solid liver, a mass, or it could even be a stool burden or ascites. So I'm going to listen, and in this right lower quadrant, I'm only hearing tympany. Moving into this right upper quadrant, I'm only hearing tympany. And then into the left upper quadrant, I'm only hearing tympany. And then in the left lower quadrant, I'm only hearing tympany. Now I'm going to percuss over the urinary bladder, which I'm only hearing tympany, which is a normal finding. If I were hearing dullness there, I would expect that there would be 400 to 600 milliliters of urine in the bladder. This patient did say that he emptied his bladder prior to entering the exam room, so that is consistent with what he said. Next, I am going to measure the vertical span of the liver. So I'm going to start at the mid-clavicular line at the level of the umbilicus, and I'm going to percuss superiorly until I hear the change from tympany to dullness, which indicates that I would have reached the bottom border of the liver, and then I'll mark that. Okay, so that and the inner intercostal space right there. And then I'm going to start at the level of the nipple line, and I'm going to percuss in the intercostal spaces from the nipple line inferiorly until I hear the change from resonance to dullness. Okay, and that is right there. And now I am going to measure this with my centimeters. And this is 6 centimeters, which is a normal finding. Anything between 6 and 12 is within normal limits. And let me measure that better on camera so you can see. My hands are in the way, but there's me measuring. Okay, the next thing I'm going to do is I'm going to try to percuss for splenic dullness. Splenic dullness is an abnormal finding. It can be an indication of splenomegaly. So what I'm going to do is I'm going to start in this left upper quadrant, and I'm going to percuss down to the mid-axillary line or anterior axillary line, which is hard to see because of the positioning of the patient and positioning of the camera, but essentially I'm going for this line on the body on the left side. And as I'm percussing at about the level of the 9th and 10th rib down into this side, I'm only hearing tympany, which is a normal finding. So this is called the Castell's sign or Castell's technique of percussing for splenomegaly or splenic dullness. You could also move into Traub space, but I opted to do the Castell's technique. The next thing I'm going to have you do, bud, is I'm going to have you take a big deep breath in and hold it, and then I'm going to continue percussing, listening for dullness. So let me know when you're ready. Okay. Again, percussing in this left upper quadrant, and go ahead and let it out. And still only hearing tympany, no splenic dullness noted. The next thing I'm going to do is I'm going to start palpation. I'm going to do light palpation and deep palpation. Light palpation is just with one hand, and it's a soft rocking motion. And this just allows me to feel for any firmness, rigidity, and I can observe my patient for any discomfort. So I'm just going to start here in this right lower quadrant, and I'm only feeling soft. There's no firmness, no rigidity. I'm not feeling any superficial organs, no masses, and I'm observing my patient, and he is not expressing any indication that he's in any discomfort or pain. So that's that right lower quadrant and that right upper quadrant. And now I'm going to move over to the left upper quadrant. And again, I'm only feeling soft. There's no masses, no rigidity, no guarding, no firmness in this left lower quadrant or left upper quadrant. And again, my patient does not appear to be in any discomfort or any pain. So next I'm going to do deep palpation. That's going to be with both hands. It's going to go about 5 to 8 centimeters deep. And this is again looking for any firmness, rigidity, masses, or observing my patient for any pain. So in this right lower quadrant, I am only feeling a soft abdomen, and it appears to be non-tender. And this right upper quadrant, as I'm doing deep palpation, I am only feeling soft, no rigidity, and it appears to be non-tender. Moving over to this left upper quadrant, again, doing deep palpation, and it appears to be non-tender. It is soft, there's no masses, and there's no firmness. And then moving to this left lower quadrant to the best that I can with the placement of his clothing. Again, soft, and there's no masses, no rigidity, no firmness, and my patient appears to not be in any pain or discomfort. So next what I'm going to do is I'm going to palpate for the bottom edge of the liver. So what I'm going to do is I'm going to place my non-dominant hand on this flank, on the right flank. go ahead and relax. And then support the patient. And I'm just going to come into this right upper quadrant with my dominant hand, and I'm just going to push at this kind of costal margin in the right upper quadrant, and try and feel for this bottom edge of the liver. So go ahead and take a deep breath. Good job. Good job. Okay, let it out. Good job. So as you took a deep breath, I was able to feel the bottom edge of the liver. It felt firm and smooth, no irregularities, and not hard, but not too firm, but soft and appropriate. So that's that bottom edge of the liver with inspiration. And the next thing I'm going to do is I'm going to now palpate the spleen, or attempt to palpate the spleen. I'm going to do the same thing by supporting behind the back. So, and I understand this is very hard to see, and I don't think that I can make my camera any better. Okay. So I'm going to place my left hand behind this flank, and I'm again in this left upper quadrant. Sorry, bud. I'm going to palpate in this left upper quadrant for the spleen, and I'm not able to palpate for the spleen. Go ahead and take a big deep breath in. Good job. Let it out. Good job. And I'm not able to palpate the spleen, and that's a normal finding. So now I'm going to move on to the special tests. First, I'm going to do Murphy's sign. So Murphy's sign is a test for cholecystitis. So essentially, I'm going to firmly palpate or press in the area of the gallbladder, which is the right upper quadrant. And as I'm firmly pressing, I'm going to have the patient take a deep breath. If the patient continues to inspire, that would be negative for a negative Murphy's sign, or negative for cholecystitis. If the patient ceases inspiration and has pain with that, that would be a positive Murphy's sign, so positive for cholecystitis. Okay, are you ready? Good job. Okay, so that was a negative Murphy's sign. The patient was able to continue breathing in while I did that. And then I'm going to do the Robsing sign for appendicitis. So what this is I'm going to just put firm pressure in this left lower quadrant. As I'm putting firm pressure in this left lower quadrant, if he had a positive Robsing sign, he would have referred pain over in this right lower quadrant with the palpation in the left. So I'm going to... Any pain?
No.
Okay, so that's negative Robsing sign. Next, I'm going to do the fluid wave shift test. It's easier to explain this since I don't have a second healthcare worker with me. If I had a second healthcare worker with me, I would have them place the edges of their hands here midline to hold these structures in place. This is a test for ascites, so if there was ascites present or fluid in the peritoneal space, I would have the healthcare worker hold these structures, and then I would place my non-dominant hand here on the right side of my patient's abdomen, and I would give a firm percuss with my other hand over on this side of the abdomen. And if there were fluid, I would get an impulse of that fluid shift over onto this hand when the fluid moves. But I can't accurately do it without a second healthcare professional, and I'm not concerned with ascites with this patient, so that's just the explanation. The last test that I'm going to do is the CVA tenderness, or costovertebral angle tenderness test, and that tests for pyelonephritis and renal colic. So go ahead and sit up, bud. Thank you. Move my stethoscope. Okay, I'm going to have you put your feet that way. And I have to lift up your shirt one more time, okay? So I'm going to lift up your shirt so I can see your back. And I need to find the level of the 12th rib, which is right here. And I'm going to move over to the vertebral angle, so the rib and vertebrae angle, so the costovertebral angle, which is right here. And I'm just going to take the palm of my hand and place it here on this costovertebral angle. And I'm just going to give a firm percussion with my fist, the ulnar aspect of my fist. Is there any pain?
No.
Good. And then I'm going to do it again. I think this way. I just don't want my back to the camera. So, any pain?
No.
Okay, and no pain there, so no symptoms of pyelonephritis or renal colic. I think that wraps up my assessment. So thank you so much for your time.